Hey everyone, today we're going to talk about the Bose sound control hearing aids. Bose is well known for their active noise canceling headphones that you see people wearing on airplanes all the time, but in 2021 they released the first direct-to-consumer hearing aid. They're FDA cleared, not FDA approved, which is a completely different ballgame, and they're based on technology that was designed for the Bose earphones, if you remember those. I thought the earphones were actually really awesome. They nailed directionality, but the problem was the form factor. People just did not like wearing this kind of clunky thing around their neck, having wires hang down from their ears. And there is a social stigma for talking or having conversations with other people when you're wearing earbuds or earphones. It's considered rude in a lot of places. I think that will change. And when you go to big cities or places that it's just common and normal to be seen with earphones and earbuds, it's not a big deal. But right now, form factor still is really important. What are the highlights? The interface truly is extremely easy to use, and the technology is based on traditional prescriptive hearing aid targets. So this could be a great gateway device for audiologists who are still a little on the fence about telehealth and fitting alternative amplification. Who are these made for? They're designed for people with mild to moderate hearing loss. You might be able to recommend them to some tinnitus patients who just need a little bit of amplification of their surroundings. These do not stream audio. We'll talk more about that later. They might be good to enhance one speaker in a small group if you use the focus mode. When you listen to it, you can hear a difference. You can hear the signal to noise ratio improve. These also might be good for somebody who listens to the TV really loudly and maybe is bothering someone they live with or neighbors are complaining. Again, these won't stream the audio from your TV to the hearing aids. You would just increase the volume. They could also be good for some audiophiles because the frequency bandwidth is very impressive. They go beyond 8,000 kilohertz, which audiophiles appreciate. And of course, these could be a great recommendation for somebody who, for whatever reason, doesn't have access to an audiologist and cannot see one in person. So these could be really, really good for a lot of our tuned patients that we see. How do these work? You've got the hearing aids and you've got a smartphone app. They're completely self-fitting devices, so the user has control over all of the settings. There are no pure tone tests or screeners involved, which might sound weird, but you can get a good fitting even without a pure tone threshold test, believe it or not. The underlying algorithms are based on NAL-NL2 targets, but the user just starts making adjustments that sound good to them. And the results of their own validation study were solid. It showed that user set gain was within 1.8 dB of gain that audiologists set, and there were no significant differences between self-perceived value and the quick SIN. If you are interested in reading that study, it's quite comprehensive. Just Google the title here. It's available to the public.